My name is Dr. Brian Gross. I work for LewisGale Physicians. I serve here as an otolaryngologist, head and neck surgeon. I've been here for about 3 years. So the common cold and sinus conditions and allergies are something that are seen almost every single day, multiple times by primary care doctors. And most of the initial therapy for sinus disease and allergies is administered by primary care doctors, and they do a fantastic job with that. What ultimately brings a patient from their primary care doctor to an ENT is when those problems are resistant to medical therapy that has been administered by the primary care doctor, or when their symptoms are so severe that the primary care doctor is concerned that something else is going on. Other things that'll bring a patient from the primary care doctor into a specialist are allergies. So patients that are suffering with either seasonal allergies or year-round allergies that again aren't responding to medications, or when they're on medications, it's just not under optimal control. Those are things that'll bring people into the ENT for further evaluation. With each of those patients then, we have to carefully evaluate to say, is this more of a sinus problem? Is it an allergy problem? Or is it a combination of the two? Because often when patients have allergies, they're gonna have sinus issues, nasal issues. And so we have to evaluate each patient for that, for those issues. After we do a full evaluation with a history, physical exam, often imaging with a CT scan, we're able to make that decision of, are we dealing with the patient with allergies, sinus disease, or a combination? And then we can focus the treatment. If we're looking at a patient that's predominantly allergies, often I'll start with medical therapy, which is gonna include over-the-counter nasal steroids, often over-the-counter antihistamines, and we'll see how patients do with that therapy. In patients that are not much better with the general medical therapy, we also offer allergy testing. The allergy testing helps us determine what specific irritants patients are allergic to and how allergic they are to each of those irritants. We can then use that data to decide, is that patient best served by having allergy desensitization, which is in general more common language of allergy shots. But one thing that's unique here is that we offer more than just allergy shots. And we discuss with every patient that has these problems with severe allergies of, would you like allergy shots or something what's called sublingual immunotherapy, which is a similar mechanism to allergy shots, but rather than coming in every week to get a shot, you're able to administer the medication at home and put a few drops underneath the tongue.